Okay, all of you can mute yourselves, and if anyone has any questions in between, please they can go ahead and ask. If anyone wants to ask any question, they can leave their question in the chat box as well. Okay, I'm going to explain you about the OET writing, what it is actually, and how do we have to take up the OET writing, and what are some of the techniques to follow, how the scoring is done, and what are some of the common mistakes which people do, and some of the grammar rules, including some of the common mistakes which people make, and some examples of the sentences which we can use in the OET writing part. So as we have a mix up of professions here, doctors and nurses, both of them are there. So let me tell you about the writing test. First of all, the writing test is different for the doctors and the nurses. It will be specific to your profession. Like if you are a doctor, the task given to you will be based on the doctor's profession, the medicine. And if you are a nurse, so your writing task will be different. Although the structure remains the same, the way you have to organize your letter, organization, the format of the letter writing, that remains the same for both of the professions. There is slight difference between the information you have to include as a nurse and the information as a doctor. And there are three types of letters for both the professions, which are referral letter, transfer letter, and discharge letter. Okay, so based on the type of letter, we have to take out specific information from the case notes, and we have to arrange it in proper sentences and then write it. Now it depends on what type of letter you are writing. So you have to uh, select the specific information based on the type of letter. So how do you have to select the information based on the type of letter? That is what we are going to learn in the course. For now, I'm just going with some of the basic information and important information, which is important for everyone to know about it. Okay, so first of all, the writing subtest is of 45 minutes duration. It remains in the duration, format, organization, structure. Everything remains same for all the profession. So it lasts for about 45 minutes, in which the reading time is 5 minutes and the writing time is 40 minutes. Your task is to arrange the case notes given to you in the form of a letter. And this letter is a formal letter. So you have to be very careful that you are organizing and you're writing a formal letter to another person. Another most important thing is the word count. That has to be in between 180 to 200 words. So if you're exceeding your word count, or if you're writing less than 180, you will lose your scores. So you have to be very careful if you want to get a good score. You have to be very careful with the word count. Now, the reading time 5 minutes and writing time 40 minutes. This basically means that in the first 5 minutes you're not allowed to start writing. This doesn't mean that after 5 minutes they are going to take the exam paper from you, the case notes from you. No, the first 5 minutes you're not allowed to start writing. After 5 minutes you can start writing. So the most important thing for scoring over here is utilize those 5 minutes as much as you can and mark the information, select the information, understand the notes, and understand what is your task and what you have to do in that. Okay, so those 5 minutes is, like you can say, a very crucial for your OET writing scoring part. And then you have 40 minutes to write, from which you can use 30 minutes for the writing and then keep 10 minutes for proofreading your task. So these rules remains the same for a computer-based test, whether you're attempting a computer-based or a paper-based, all these rules remains the same. Okay, let's move on. So first of all, how to improve your performance in the writing subtest. There are few things which are very important for your scoring part. So the first thing is you will be assessed on how efficiently and effectively you are writing the letter and how easy it's for the reader to retrieve the information from your letter. Okay, how well the reader understands what you have written. So your letter should be very clear and easy to understand. The first thing. The second thing is about the language you're going to use, the way you prioritize your information and structure your letter. So which information do you want the person uh, to think that this information is much more useful than the other information? So the way you're organizing your information is much more important. Okay, then you can for this you can make a checklist of some questions, and while you're proofreading your work you can verify for each checklist whether you have fulfilled that task or not. So some of the questions which you can use over here is, first of all, who is the intended reader, whom you're writing to. For example, if you're writing to a specialist, if you're writing to another GP, you as a GP writing to another GP, if you're writing to some kind of director or a registrar or admitting officer to admit the patient urgently. So these are different types of the letters. Referral letter will be you're writing to a specialist. It can be any specialist. It can be an orthopedic surgeon. It can be a gastroenterologist. It can be a gynecologist, pediatrician. So any specialist, that is a referral letter. Transfer letter is when you're writing to another GP and you're writing to admitting officer, you're writing to a registrar or a director for transfer of care, for follow-up care, for admitting the patient on immediate basis. Okay, these are the cases for the transfer letter. And discharge letter is very simple. The patient got admitted for something, got the treatment, and now getting discharged. So that is a discharge letter. So whom you are writing to, that is very important for you to understand at first, because based on that only you're going to select the specific information. Now, the second question is, what are the main things I want the reader to do? Okay, what I want the reader to, that is the person whom I'm writing the letter, what do I want from him? Do I want the person to uh, provide ongoing care to the patient? Do I want the person to, maybe I'm, for example, I'm suspecting a patient to have diabetes mellitus, okay, and I'm writing to the endocrinologist. I'm writing to confirm, like I want the person, I want the endocrinologist to confirm the diagnosis of the patient. Whatever I am suspecting, I want the opinion of the endocrinologist. Okay, so that is what. Do I want the opinion of the person I'm writing to? Do I want further treatment, further management? Do I want him to continue the ongoing care or follow the discharge instructions and take care of the patient? Or I want the person to admit the patient immediately. So that is what I want the reader to do. What does the reader need to know? This is the most important thing. So what does the reader need to know? It depends on, again, whom you are writing to. For example, you are writing to an endocrinologist. So whatever points or whatever condition of the patient is important for the reader to know, for the endocrinologist to know, only that conditions I will mention. Okay. For example, the patient has history of diabetes, or maybe the person is taking some hypoglycemic medication since 5 years. So these are some of the information which is important for the endocrinologist to know. Okay. Maybe I have some information mentioned in the case notes that the patient presented to me last week and was complaining of cough and fever or sore throat. That is not important for the endocrinologist to know. Okay, so this is the information which the reader needs to know. You have to stick to that relevant information. Including irrelevant information in your quiz notes, your score easily goes from A to B and B to C. Okay, so be very careful with that. Okay. The next thing is, after you have finished writing, proofread your work and check for any changes you can make, check for any points which you can improve, and check whether you have written much complex sentences. Okay, it should be very easily understood, and it should be for the very clear for the reader to understand what you are trying to say. Is my voice low for everyone, or it's just for one person?
No, I think it's audible.
It's fine, right? Okay. Okay. So now the next thing, how to get an A in writing. Now, getting an A is not too difficult. I can say it's very easy to get an A in writing subtest if you at once understand that what are the basic things we have to be careful with, what are the scoring categories, how will I be given the scores. So if you're like clear in your mind how you're going to getting the scores and what tasks you have to follow, what techniques you have to follow, which are the statements which will give you more marks as compared to the others, what types of words you have to use, what type of grammar, maybe the tenses or the punctuations or some of the prepositions, what types of grammar are you going to use. So if you understand all these things, it's not very difficult to get an A. You can get it very easily. So first of all, use your time effectively given for reading the task. So that 5 minutes, which is given at the start, utilize that time and understand the task. That time is very, very important. Then second of all, you have to read whom you're writing to. Okay. So first of all, when you start reading the case notes, you have to, after reading the name and age of the patient, go directly to the question and see whom you're going to write the letter to. Based on whom you're writing to and what do you want from the person, it will be mentioned in the question. What do you want from the person and whom you're writing to? Based on that, you have to select the remaining information from the notes. So first, reading the question always helps. The second thing to know is what type of letter is it? Is it for the follow-up? Is it for the home visit, referral, transfer, or a discharge? Okay, so what type of letter is it? The next thing is underline the relevant notes you need to mention in your letter. So if anyone is attempting a computer-based test, you can even highlight the points over there. So mark the points which you want to include. Finally, start the task as per your writing test task format. That is starting with the introduction. Now, there are some strategies to follow which will help you to organize your letter in a very effective way. Here is one example. If, for example, you're writing a letter to the director, okay? So before you start writing, you have to remember four questions. Again, whom I'm writing to, so you're writing to the director. Whom I'm writing about this patient whose age is this and who has this problem or this issue or this diagnosis or major complaint. Okay, these are the things included. What has happened? Is there any major complaint? Is there any kind of urgency, emergency? Okay, what type of letter is it? Is it a referral? Is it a transfer? Or is it a discharge letter? So when you make the answers in your mind for these, it will be easy for you to organize your letter. This is an example of a question using the information in the case notes. Write a letter to the director and the address is given requesting follow-up of this family. Whom you're writing to the director and you need follow-up for this family. Okay, so this is a transfer letter. When you're writing to a specialist, that is a referral letter. Now, what are the basic steps to follow while you are doing the writing task? Read the writing task and check with whom you're writing the letter to. Okay, first of all, then check the type of letter. Is it transfer? Is it referral? Or is it discharge letter? Okay, read all the points of the discharge plan very carefully. Not only the discharge plan, if it's a referral letter, read the points of the referral plan very carefully. That is the last part. So the last part of the letter, that is before the question, that is very important. The last visit, it can be a last visit, it can be a discharge plan, it can be a transfer plan. Okay, so that is most important. You don't have to exclude any information from there. Then read the left out case notes and underline the relevant points to be mentioned. Start writing the letter as per your format, whichever you are following. Try to complete the task 5 minutes before and go with the proofreading. Make sure your word count doesn't exceed 180 to 200 words. Now, going through the case notes, understanding the case notes. Read the writing task and check whom you're writing to. Check the type of letter, check the plan carefully, and then underline the main points. Now, in the first 5 minutes, as I mentioned before as well, start writing. Don't start writing in the first 5 minutes. You're not allowed to start writing. Utilize those 5 minutes to select the information. Now, one example here, using the information, writing to the director, requesting follow-up. So whom you're writing to the director and requesting follow-up. This is the type of letter you have to, like, you can understand what type of letter is it from here. So this is follow-up is for the transfer letter. Next, for example, we have a discharge plan appears to have fully recovered from mumps. This is about the patient and acute meningoencephalitis. Will need advice on recommended vaccines for both children. Will need neurological checkup. So these 3 points we have to tell to the person whom we are writing to that this patient requires this thing. Okay, we are requesting the person to consider these needs of the patient. So you don't have to miss any point from these. Everything should be included if it's a discharge plan, referral plan, or a transfer plan. Next comes the abbreviations. Now, sometimes in your case notes, abbreviations are used. Most common ones are mentioned here, but you have to be aware of the abbreviation. Sometimes it becomes difficult to understand that what is this abbreviation mentioned. So there is a complete list of abbreviations we have, and some of the abbreviations are allowed for you to use in your letter. Some of them are not. Most of them are not. Some of them are allowed. So you need to know about them, that which one is allowed and which you have to use and which you don't have to use. Okay, for example, in the case notes it can be mentioned SOB, so that is shortness of breath. Okay, BP, so blood pressure, over the counter, review, intensive care unit, capsule, fracture, and patient. This is patient, sorry, not patients. Okay, so these are the most common ones which are used in your case notes. Next thing is choosing relevant information. Okay, now how do you choose the relevant information? When you're going through the case notes, you have to go through the patient's name, age, gender, admission and discharge date. This is for discharge letter. Present condition, treatment that was given, and improvements in the treatment. Okay, so now how do you have to choose the information? The first thing is initial sentence. Initial sentence means your introduction. I'm writing to refer so and so. That is your initial sentence, the way you start. Second is vital issue. That means the major complaint of the patient. Now, it can be a major complaint or it can be a diagnosis, which has already been made. Okay. For example, I might say that I'm writing to refer Mr. Brett Collister, who presented to me or who has been diagnosed with type 2 diabetes mellitus. So that is the person is already being diagnosed. Okay, if I say I'm writing to refer Mr. Brett Collister, who has complaints of left leg fracture, for example. Okay, that is a major complaint. Why is the patient here? Okay. The third thing is I'm writing to refer Mr. Brett Collister, who has signs and symptoms of diabetes mellitus. Now, this means that the diagnosis is not yet made. I am suspecting this diagnosis. Okay, so these are the differences in statements you use based on the information given. So that is the initial sentence. Vital issue is the diagnosis or the major complaint. Then you have the secondary issue. Secondary issue can be related to medical history, medical factors, or social factors. For example, if it's a case of depression or some kinds of psychiatric illness, Then you can mention about the social factors, that the person lives alone, has no friends, and like this kind of information. These are the secondary complaints. Any other details includes your medication or any relevant history of the patient. Okay, and finally the request, that is your conclusion, that what are you requesting the person to do, what you're requesting the person whom you're writing to. So this is the main thing you need to understand for choosing the relevant information. I hope everything is clear so far. Now we have some examples here. First of all, your introduction, ways to write the introduction. If the name of the person you're writing to is included in your case notes, for example, the person I'm writing to is Dr. Wilson. So I'll be writing it as Dear Dr. Wilson and followed by a comma. If the name is not mentioned, it can be Dear Sir or Madam, Dear Director, Dear Registrar, or if, for example, it's Admitting Officer, so Dear Admitting Officer. Okay, then next you have the subject, in which you have to very clearly mention about the name and age of the person you're writing about. Okay, that is R.E. Dylan Charles, so name of the person, and age 40 years. So sometimes in some of the case notes, you'll be given the age, and in some of them, you'll be given the date of birth. So whatever information is given, if it's given date of birth, you'll be writing that. Now, in the introductory paragraph, what do you have to include in your introductory paragraph? Background information, that includes your name, age, occupation. Sorry, not your patient's name, age, occupation, gender, and marital status, only if relevant. Okay, that means if marital status is having any kind of effect on the patient's condition, then you can write, otherwise you can skip this. Occupation, if relevant, you can write, otherwise just exclude it. Okay, so these are some things. Gender, occupation, or marital status is something, if it is relevant for the patient's condition, then you can write it. Okay, and next is brief summary of chief complaint or the purpose of writing. Why are you writing this letter? What do you want from the other person? So your purpose of writing is the most important part of your letter that has to be mentioned in your introduction as well as your conclusion. Okay, your purpose includes, for example, further management, ongoing care, opinion, or getting a diagnosis from the person you're writing to. Okay, and it will be mentioned in the question. If not in the question, at the end of the case notes. Okay, so purpose is the most important part. Do remember this thing. Okay, we have some example sentences here for the introduction part, how you can use the introduction statements. I'm writing to refer this patient, a 63 years old man who lives alone. Now here, there's a grammar mistake. Okay, so you have to be very careful. Even a minor grammar mistake will affect your scores. I'm writing to refer this patient, a 63-year-old man who lives alone. So not years, year. Okay, and this is another way. I'm writing to refer this patient who is 63 years old and lives alone. Okay, so this is the correct way of writing. Okay, next is some sample introductions. Here we have, so dear so-and-so, RE, that is the patient's name and date of birth. I'm writing to request daily home visits by the Blue nurses to provide care and support for this patient, a 61-year-old widow who lives in her home. Okay, so now name, age of the patient, and why are you writing the letter. That is, your purpose should be very clear in your introduction. So in this, what's the purpose? Daily home visits. This is the purpose. In the second one, I'm writing to request aged care assistance for Mr. So-and-so, who is recovering from malignant melanoma in his left shoulder. So a major complaint, a major problem here. And what do I want? I want this. Okay, so complaint and your purpose of writing. Both should be included in the introduction. I'm writing to request a respite admission for this patient, 41-year-old married mother of two who has been receiving personal care from our organization over the last 2 months. So I'm writing to request what? The admission of this patient. I want that person to admit this patient. I'm writing to refer this patient who was admitted to our CCU 10 days ago with diagnosis of myocardial infarction. A cardiac artery bypass graft was done, followed by post-operative treatment and physio. His condition is now stabilized and he is being discharged today. So this is a discharge letter. Okay. In discharge letter, you have to mention when was the patient admitted, why was the patient admitted. So the time and reason of admission, and what treatment was given over there, and now he is being discharged. Okay. So these things for the discharge letter. Okay, next we have some of the common errors here, which usually people make. I'm writing to refer Mr. Andrian Lamb to you, and 61-year-old widower. He is due to be discharged today. He has made full recovery from chest congestion. I'm writing to refer this patient to you. So why I'm writing this patient? Because I've already written the full name here. Okay, but writing the full name in the introduction is not incorrect. Okay, but your sentences should be as short as possible. So your introduction should be as short as possible, and ideal length of the introduction is 3 lines. Okay, not making your introduction longer than 3 lines. 61-year-old widower who is due to be discharged today. So instead of writing he is due to be discharged, who is due to. So you have to connect the 2 sentences. Then, thank you for admitting Mrs. Saunders, an 80-year-old dementia patient who requires respite care for a period of 2 months. So connecting with who. So who, which, the connecting words are important. Cohesive words are important. Okay. Use of however, in addition, besides, along with. Okay. Although these kinds of words is important. At least 2 or 3 of these words should be there in your letter. Okay, I'm writing to refer Mrs. So-and-so, a 77-year-old female resident at the Sandy Beach Retirement Village who needs urgent admission to your hospital due to chest pain. So, name of the patient, age, major complaint, and what is the purpose? Urgent admission. So this information should be covered in your introduction part. Name, age, complaint, or diagnosis along with the purpose of it. Now the structure of the paragraphs. First of all, a topic sentence, which will introduce the reader to the main idea of the paragraph. That means what you are writing in your introduction, the reader will understand that this is the basic thing which I'm going to follow through the whole letter. Like this is the diagnosis, that diagnosis or the major complaint will be immediately clear for the reader. That is why it should be very clearly mentioned in the introduction part. RE means referring, like you are referring that patient, regarding that patient you're writing. Okay, so you have to write the name and age of the patient over there. Okay, the second thing is your supporting sentences, which includes the patient history, symptoms, treatment record, causes, effects, and so on. Changing of some of the words like complaint to complaint. So the patient presented today with complaints of. Okay, so instead of writing complaint, you will be writing complaint. Okay, the patient has been lethargic. So the patient was feeling lethargy. So you can, this is something which you can change it in your own words. So wherever you can paraphrase it in your own words. Whichever word you can paraphrase, make it in your own words. Okay, instead of writing the same word, use a high level of vocabulary and try to make it in your own words. Okay, next things we have here are some of the signal words which will help you present your information clearly and logically. For the time, you can use at that time, on review today, on consultation today, recently, 2 weeks later, on subsequent visit, on initial visit, okay, on initial examination, location during hospitalization, on examination, okay, in order to add more information. In addition, moreover, apart from this, for making contrast, although, despite, and however, for result, therefore, consequently, as a result, for this reason. So the patient was complaining of this thing. As a result, or maybe for this reason, this treatment was performed. This is an example. Okay. Emphasis. If you want to emphasize some information, you want the reader to you want the reader to understand that this information is very, very important. So in that case, you have to use please note. May I remind you, my main concern is what concerns me the most. Sympathy, unfortunately, regrettably, fortunately. Then in subject, in terms of social history with regards to her admission, based on the blood test, regarding the medical history. So these are all the words which adds to your language scores. Okay, your use of connecting words and your use of cohesive words. Okay, in order to follow the chronological order, although that's not important, firstly, secondly, and finally, but this is very rare to use. We don't advise using this. And in terms of advice, it is important to do that. I recommend, or I have recommended, kindly recommend, kindly ensure that, kindly motivate the patient, kindly encourage the patient. These are the words that can be used for advices or requests. All right, so we have some more examples here. We have the case notes here. The diagnosis is right partial rotator cuff tear, presented to Metro Hospital with pain and weakness in the right shoulder, especially when lifting arm overhead. Descending stairs at home, slipped, falling onto the outstretched hand. X-ray MRI showed a partial rotator cuff tear. Date of admission, date of discharge is given, and treatment was ibuprofen, cortisone injections, and daily physio. Okay, then the medical history and nursing care needs. So now you know why was the patient admitted? Because of rotator cuff tear. What treatment was given? Injections were given, physio was given, and ibuprofen medicine was given. Medical history is diabetes mellitus and metformin. So based on the condition of the patient, which do you think, like what do you think is the medical history relevant? Yes, it is relevant because it's a rotator cuff tear. So she was a diabetic patient. So you'll be writing about the diabetes mellitus and metformin. So based on the condition of the patient, you have to select the medical history. Nursing care needs, she needs monitoring for hourly, maybe elevated because of cortisone, needs assistance with shower and housework, orthopedic review on 19th November. So everything will be mentioned in the nursing care needs. That means what care was given during her hospital stay. Okay, so you have to write this. Then the social background. Marital status, she's a widow, no children, lives alone. Is this relevant?
No.
Not much. You can just write that she lives alone, or maybe she's a widow. So I think only one thing will be fine. Okay, even if you exclude everything from here, it doesn't matter. Like it will not affect your scores. Next of kin, not important. Niece lives with husband in Sydney who works as software engineer for Google Australia. Sister died recently, no other relatives. So no relatives can be mentioned, otherwise no other point is relevant here. Okay, so based on the diagnosis and based on the condition of the patient, you have to select from the medical history, from the social background, and from the treatment. Yes, please.
Yeah, I just want to know, is there any list of connectors, means particular connectors which we can use in OET?
Yes, there are. There are, because some of the connectors are used as informal words and some are considered as formal. So you have to be very careful in selecting the use of connect. For example, if I give you the example of but and however. Okay, so but is an informal word and however is a formal word. Okay, so we have a list of connectors and you have to use only those which are formal ones.
Okay, and are you able to share those lists? Because I have read on the OET site that earlier the hence it was allowed, but now it's prohibited that we cannot use hence in our OET letters.
For hence, normally for the results, which I have mentioned in my previous slide also, it was there, therefore, consequently, as a result. These are much more appropriate to use whenever you are mentioning the result of something. Okay. So
Yeah,
thus
thank
and hence is very like rarely used and we don't recommend using that. Okay, so there are some things which you need to understand to get a higher grade. So these are the minor things which we have to take care of to get a higher grade. Okay, so for this, how the paragraphs will be arranged. Miss Harwood was admitted to our hospital on 30th of October with the diagnosis of right rotator cuff tear following a fall while descending the stairs. So your introduction starts with if it's a discharge letter, it will start with why the patient was admitted and when was the patient admitted. Okay, and reason and date. Okay, and then what was if the treatment has been given, what was the treatment given. Okay, and what do you want from the person you're writing to. Okay, so three things in the introduction. Again, she has received ibuprofen and cortisone is prescribed in daily visits by a physiotherapist. In terms of her medical history, she suffers from type 2 diabetes. So in terms of her medical history, so these underlined words, if you can see here, these are much more important. Therefore, however, and yes, one more thing, avoid repetition. If you have used however or therefore at once, use it just once. For the second time, if you want to use a different word. Okay, so we have a list of words, we have a variety of words, use a different one. Okay, as well as this, she needs to review her condition with an orthopedic surgeon on 19th of November. Lives alone, has no children. Next of kin, this is just a how to form the statement, but this information is not important. This is irrelevant information. Okay, this is the second example. So it's almost the same as the first one. So here, this is the conclusion part. Could you please support and advise the mother regarding the breastfeeding and correct preparation of formula feeds if required? Could you please? So could you is used for requesting the person. So never use should in your letter. Okay, especially your conclusion. Could you please do this? It would be appreciated if you do this. So would and could are used for requesting part. In addition, please note, okay, these kinds of words are to be used. Now we have some of the grammar rules here. For example, we have a sentence, I'm writing to refer this patient. He is due to be discharged today. He has made a full recovery. So instead of writing such simple statements, just combine it. I'm writing to refer this patient who is due to be discharged today after making a full recovery. Not a very complex one, not a very easy one. Okay, a medium one. I'm writing to refer Miss Berry. He is 68 years old, pensioner, widower. He requires dietary advice for undergoing heart surgery. So I'm writing to refer Mr. Berryboth, a 68-year-old widowed pensioner, and a comma here, who requires dietary advice for undergoing heart surgery. Or maybe just a full stop here, who has been suffering from this. The complaint is not mentioned here. So he requires your dietary advice after going the heart surgery. Make the purpose statement like separate one and combine the remaining information into one. Okay, not too complex, not too simple. Okay, next we have some of the statements which are considered as informal, polite, and more polite. Okay, so you have to stick to more polite ones. This one is also fine, but more appropriate is this. So informal, for example, can you examine and treat the patient as you feel appropriate? Please examine and treat the patient as you feel appropriate, or could you please examine and treat the patient as you feel appropriate? So could you please, could is for request. It's a more formal word here. Okay, I would be grateful if you could examine, diagnose, and treat the patient. I would appreciate if you could examine, diagnose, and treat the patient. So use of would and could. It would be greatly appreciated if you could examine, diagnose, and treat the patient. Okay, so whether you use active voice or passive voice in the conclusion, that doesn't matter. Your use of words matters here. Okay, you can use both of the ways. I hope you can arrange someone to help this family and provide proper medical support. Okay, so these are the sample sentences which you can use in your conclusion part. Okay. Next, there are some rules of using commas in conditional sentences. Now, if we have a sentence, for example, if you could take over her ongoing care, it would be greatly appreciated. If is at the start of the sentence, so you'll use a comma after one clause. Okay. If it is at the center of the sentence or in the middle of the sentence, you'll not be using a comma. It would be greatly appreciated if you could take over her ongoing care. So if is present in the middle, no comma, and if at the start, a comma after the first clause. Okay, similar case here. If you require any more information, please don't hesitate to contact me. So if is at the start, comma will be here. Please don't hesitate to contact me if you require any further information. So no comma here. So this is a basic rule of comma where most of the people do make mistakes. Okay, so be very careful with it. Okay, another example is, should you have any further queries, please don't hesitate to contact me. Okay, so a comma here, and please don't hesitate to contact me should you have any further queries. Okay, so some more examples here. Now, some of the statements, sample statements for conclusion. In order to maintain a good condition, Mr. O'Reilly has requested advice on low-fat dietary guidelines and healthy, simple recipes. It would be appreciated if you could send the above mentioned information to this. So the address of the home is given. Okay. Now, for example, we have using the information in the case notes, write a letter to the director requesting follow-up of his family. So what is our purpose was requesting follow-up. I hope you will be able to arrange someone who can help his family and provide proper medical support. Okay, this is the way you're concluding the letter. You're writing to the admitting officer, admitting doctor of the Medivale Hospital Emergency Department. Give the recent history. So I would appreciate your assessment and emergency management. Because it's an emergency department, so you have to write emergency management or immediate management. Okay, so again, the use of words here. If we have a referral letter to Dr. Jane, who is the medical practitioner, requesting assessment of your patient's condition. So assessment, this is our purpose of writing. It would be greatly appreciated if you could assess the patient's condition and treat as you feel appropriate. If we have a discharge plan here, organize social worker and meals on wheels, stitches to be removed and situation to be reviewed at outpatient department at this time and on this date. So it will be greatly appreciated if you could do daily home visits and provide support and reassurance for Mrs. So-and-so. Please organize meals on wheels and social worker for some help. So instead of the word help, you can use the word assistance here. That is much more formal. Okay, so the difference between formal and informal words. Please note the patient has an appointment at the outpatient department on this for removal of stitches. Thank you for your ongoing care. Okay, so these are the formal statements which you have to use. Some of the most common errors which we have in the conclusion part. If you have any query, please do not hesitate to contact me. If you have any queries, please do not hesitate to contact me. So queries, query and queries. I would appreciate your further assessment and management. So don't use will, use would. Okay, and don't use should also. Kindly investigate this chart. So I would appreciate if you could investigate this chart. Okay, thanks to review and arrange a home visit. I would appreciate if you could review and arrange a home visit. Okay, so I would appreciate if you could do this, or it would be highly appreciated if you could do this. Always make your conclusion like this. Okay, it's a completely formal letter. Okay, next, there are three major common mistakes which are like quite common in the OET writing part. First of all is using rule out to mean confirm. The word rule out. Rule out means to eliminate something or to exclude something which is impossible. Okay, so the case notes say that pneumonia was ruled out. That means the person does not have pneumonia. Okay, so you have to be very careful with these small sentences. Using complaint instead of compliant. Okay, so this is also one mistake that most of the people do make. Medication taking regularly as per the instruction. The letter written by the student reports the patient is compliant with their medication. So compliant with their medication means they are taking their medication, and complaint means what complaint they are making. Okay, what was their complaint? So be careful with these small words. Using advice instead of advice. So with SE and CE. The case notes say that smoking methods to quit as discussed. The patient was advised to quit smoking. So here you have to use advised. The patient was advised to quit smoking with SAD. Okay, so these are the most common three mistakes which people usually make. So I have mentioned it here. Now, sticking for the word count of 180 to 200 words, it's not like you have to follow this rule only. It's just for your help that you can organize your letter in this way, keeping your introduction up to 225 words, first paragraph and second 40 words, third 75 because it has the discharge plan or it has the referral plan, so that has to be a longer one, and a conclusion of 25 words. So if you are organizing your letter with these word counts, it will be very easy for you to stick in between 180 to 200. You will not exceed it. Okay, so it's an ideal one. It's up to you if you want to follow or not, and it depends on the information also. Sometimes we have more of medical history, sometimes we have quite less relevant medical history, so it depends on that as well. Okay, next is the scoring part of OET writing. How the writing is scored. There are different categories of scoring. We have around 6 subcategories on which your writing is scored. And once you understand that how the scoring is done, when you are rechecking your writing after completing your letter, you have to check for each category whether I have fulfilled this category, I have fulfilled this. So that is for your own rechecking part. So that is also much helpful for getting a good score. Okay, the first category, the most important category, as I mentioned before as well, that is the purpose. So your purpose should be very clear in your introduction as well as your conclusion. Okay, you can split your purpose into two parts: immediately apparent and sufficiently expanding. Now, what does this mean? Immediately apparent means immediately clear in your introduction. It should be very clearly written that you're writing to, for example, if I'm writing to discharge Mr. So and so. Okay, that is immediately apparent that I'm writing a discharge letter, or I'm writing for the discharge of this patient. Okay, and sufficiently expanding means he requires your further management and ongoing care. That will be sufficiently expanding. Okay, what else do I need from that person? So this is the main thing for the purpose category. Now the second thing is how to choose the right content. Again, it depends on the audience you're writing. Okay, the person you're writing to. So you have to accurately represent the case notes by making them into complete sentences. Okay, and based on the person you're writing to, you have to select which information is important. As we discussed some examples, like if it's a referral, if it's a discharge or a transfer, how the information is selected. The third category is conciseness and clarity. Conciseness means keeping it to the word count, keeping it as short as possible. Okay, and clarity means it should be very clear for the reader to understand it. Okay, so you have to decide what information is unnecessary and you have to exclude that information. Okay, irrelevant information, repeated information, all of these things will affect your scores. The next thing is gender and style. That is the your tone of writing. Okay? That is the formal tone. So if you are including even a single informal word in your letter, again, affects your scores. So you have to be completely formal in your language you're using. The next thing is organization and layout. The way you are organizing your letter, the way you are organizing your different paragraphs, your introduction, then maybe the medical history, medical and social history, then maybe the visit histories and presenting complaint along with the referral or the transfer plan or the discharge plan. It's not very important to organize it in a chronological order. Sometimes in some of the case notes, we can write the present first and then we can go with the history. Okay, so based on the case notes, we have to decide which method is appropriate for that particular case notes. Okay, and you have to be very careful with some important information that should be much more apparent, okay, than the other information. Next category is language. Language includes your use of grammar, vocabulary, punctuation, and spelling. So your grammar includes your use of tenses. If you're writing the history, you have to stick to past tense. If you're writing the present, you have to stick to, most of the time in formal letter writing, we use present perfect tense. Instead of simple present tense, we're using present perfect tense. That means if I'm saying the person has been diagnosed with something. So if instead of writing the person is diagnosed, I'm writing has been diagnosed. Okay. So these are the rules of tenses which you're using. Use of conjunctions, use of prepositions is very important. Use of punctuation and commas is very important. Next is your use of vocabulary. Now you don't need a very high vocabulary over here. By vocabulary, what they mean is they want you to paraphrase some of the words in your own word, in your own language. For example, if it's written that the patient was advised for this. Okay, so instead of writing advised, you can use the word recommended. The patient was requested to do this. Okay, this is like the words which you can change. Next, what you can change here, if the patient was advised to quit smoking. Okay, so you can use the word cease instead of stop or quit. Okay, so this is these are the words which you can paraphrase and use it in your own words. Maybe if in the case notes it's written the patient had mild temperature or like slight temperature, you can write mild fever. Okay, then maybe the patient is complaining of there is no definitive diagnosis, patient is complaining of headache, vision problems. So all these kinds of issues are there. So you can use a common word over there. Neurological symptoms are there. If something related to psychiatric is there, so you can write psychological problems are there, psychological issues are there. Okay, so this adds to your vocabulary part. And the other thing which gives you score in your language is the use of connecting words, which has to be formal words, not informal. Okay, your use of cohesive words, okay, your use of contrast words, that is however, although, these kinds of words, okay, as a result, therefore, all these words. Punctuation, use of comma is very important. Wherever you have to use the commas, there are some rules of using the commas, and no spelling mistake should be there. Okay, there are some other rules as well. It includes the use of capitalization, that is which word, the letter of which word you have to keep capital. The names of the people you have to keep capital. Then the name, maybe the name of the month. For example, I'm writing 4th July, so I'll keep J capital. Okay, so that is the basic rule of the capitalization. Apart from that, we have some other for the names of medications. If the brand names are mentioned, then it has to be capital. If the chemical name is mentioned, then it has to be small. So these are like minor rules, but these are some of the things where people do make mistakes and they're not aware of these things. So these are the 6 categories on which you are scored on. Once you understand these categories, then you can check your own letter as well and find out your mistakes. Now, finally, some of the do's and don'ts of OET writing. What things you have to take care of. First of all, summarize all the information from the case notes into different sections, such as the treatment given, trends, medications, the way it is easier to write, and avoid repetition. If there is no need to follow a chronological order, it's not important. Okay, but it should not be too long and it should not be difficult to read, and it letter it should focus on the main problem and the relevant factors. The second thing is your word count. You have to stick to between 180 to 200 words, and that is only the body of your letter. Your addressing part and your closing part is not important in your word count. That is not counted in your word count.
Bismillah.
Okay. Then the next is omit information which is not directly relevant to your task.
Camera cover.
So that is whichever information is irrelevant, you have to exclude that. Okay. Then expand all the acronyms. For example, OPG. Don't write OPG. Blood pressure, BP, okay, and PR, pulse rate. Now there are some of the abbreviations which you can use, which are allowed to use. Okay, there's a list which you're allowed to use. So I think going through that will be helpful. Provide a simple, clear summary of the condition so that a lay person could understand. So simple, clear summary, make it as simple as possible. Use articles a and the before the countable nouns. That again comes in the rules of the grammar, is use of articles, where you have to use a and the. Use of synonyms so that you can express the information from the case notes in different ways. So that is your paraphrasing part, that is you have to write in your own words. Spend some time reading the case notes and grouping the information. For example, all the medicines together. If you're going with the history, then medical history and social history together into one paragraph. So combine the similar or the relevant information together into one. And then 10 minutes is an ideal time for rechecking, but still at least 5 minutes should be there to proofread your work. Okay. Some more final tips here. Use the reading time accordingly. Organize your case notes in a structured and well-organized manner. Include at least one of the following points or both for a positive impact. In your introduction part, that is the main medical issue, request, and purpose in the introductory sentence. Distinguish between the main and the secondary issues, understand the difference, understand the task, and check out the samples available. So read as many samples as you can to get more ideas on how you can arrange the different types of case notes. Understand the task properly, write a separate paragraph for any other details. So that means if there is history, so write the history separately. If there is present complaint, keep that separate. Referral explicitly described in the last paragraph. That means whatever your purpose of writing is, you have to again describe it in the last paragraph. Okay, your letter should tell a story to the reader. That means this is the for example, if it's a discharge letter, so the patient came with complaints on this. On admission, this was his condition. During his stay in the hospital, this was the treatment given, and he has improved with this thing. Now he is getting discharged. So what is his condition? Okay, so it should be a kind of a story, easy to understand and organized in an effective manner. If it's a referral letter, for example, you have 5 or 6 visit histories of the patient. So initially visited with this complaint, then on his next visit, this was the complaint and this treatment was given. Then now what is the complaint and what is the plan of referral? So I think most of the things are clear, and if anyone has any questions, please go ahead.
Uh, Hello, Dr. Sara. I have one question.
Yeah, sure.
After 5 minutes, we will be have this task with us.
Yes, you will have the task for the complete 45 minutes. Okay. In the first
Oh.
5 minutes, you are just not allowed to start writing.
Okay. Thank you.
Yeah. Sometimes they bring more than one diagnosis, sample of introduction. Okay. Sometimes they do bring more than one diagnosis, but that is what we discussed as the main complaint and the secondary complaint. Okay. So this is what you have to understand, that what is the main complaint, the major one, and what is the a secondary complaint. Now, one easy way to identify this is if you see at the end of the letter before the question, there is the major diagnosis. It's mostly, most of the time you will find the diagnosis over there or somewhere at the start. Okay, so the diagnosis will be very clearly mentioned over there. And sometimes if you have to, for example, you have 2 diagnoses given. One will be the diagnosis which was like some treatment was given and that was cured. Okay, and the other is still going on up till the present. So reading the present complaint, the present visit complaints will help you identify which is the major complaint of the patient, the main one. How we will differentiate whether it is discharge letter, referral letter, or any other. That is from the question, basically. Most of the time, we can identify it from the question. The 3 things which I mentioned, if you're writing to a specialist, it's a referral letter. If you're writing to another GP for follow-up, or for urgent admission case, or for some kind of ongoing management, that is a transfer letter. And the person is getting discharged, that will be a patient was admitted for something, now getting discharged, so that will be a discharge letter. Most of the time it's very clearly mentioned in the question, but if not, then you can identify from these 3 things which type of letter is it. And yes, one more thing is that for the discharge letter, history is the least relevant because the patient is admitted, so the person is already aware of the history. Yes, only letter writing. One task will be given to you and it will be a formal letter. It can be any of these 3 types. Transfer and referral is more common for the doctors. Discharge and transfer is more common for the nurses. 63 years or 63 year. Okay, it is 63-year-old patient. If you're writing aged dash 63 years, then years. If you're writing in the introduction, a 63-year-old patient, then year, not else. So you have to be very careful with these small things for the letter writing. I hope I have given a lot of information and everyone is clear with the concepts of the writing.
I have a one question now.
Yes, please.
Yeah, suppose if there means the purpose is follow-up care, right? And we have mentioned this and that for this patient we require follow-up care from you. So in the request para, if we are mentioning again that please take over on his management and provide him a follow-up care, so our marks would be deducted for repetition or not?
Yes, if you are writing in the introduction that she requires your follow-up, and in the conclusion again you're writing follow-up, then yes, it will be considered as a repetition. Now you can change this in a different way. You can say ongoing care. You can say she requires further management. Okay, it means the same, but use a variety of words.
All right, means ongoing care. Because ongoing care is the care no, which we are giving him during the hospitalization, and we want our recipient to continue with
Normally
it
what we do is
further.
in the introduction we usually write for the management, and in the conclusion we write about the follow-up. If the question says follow-up, then write that in the conclusion. In the introduction, write for the management or
Okay,
further care. You can write further care also.
further care. And earlier we means actually I have taken the lecture of from I have attended one of the lecture from Rebecca, and she was saying earlier first we can write a continued care, but now she suggested instead of continued care you should write a continuing care in the purpose. So is
She
that correct?
requires your continuing care for continuous care. It depends on the statement you're writing. Like if you're writing, she requires your continued care for her condition, or she requires your continuing care. It depends on the tense and the sentence you're using. So continuing care will be much more appropriate. But continued care is also not incorrect. Grammatically, it's not incorrect.
Okay. Thank you so much.
Any other questions?